Can I just check? Can you hear me? Are you able to hear me? We're starting in a couple of minutes. I think Liam was dealing with the amplification, so we just need to check when he comes back. I'm on, yes, but perhaps the volume needs turning up. So, Martin, can you turn the volume up on that speaker?
Try that now.
Is that any better? Can you hear me now? A bit more, perhaps?
That's the maximum, is that?
That's the maximum, is it? Okay. I'm just testing before we start, because we are going to be live streaming the meeting, okay, onto Facebook, just to let people know. And so it's important we let you know that. Concerning fire regulations, you can see there's a way out here, and also back through the doors you come to the right and the left, where it's pretty obvious. So I think those are probably the main things that we need to warn you about before we officially start. We've got just a minute, 2 minutes left.
And no seats left.
No, thank you for those who prepared to sit on the floor. There's one seat over here, but it might be Liam's, I'm not sure. Or is Liam doing Liam, we have got an overflow in one of the other rooms here, like we did on one previous occasion. So it may be that Councillor Liam Diltree is organising the overflow live stream for people who can't get in. Just before we start, another announcement is if we have somebody taking the microphones around for the questions, could you make sure that you hold the microphone very close to your mouth like this? Don't touch the microphone with your lips, but I've heard someone say if you put your thumb on your chin, then that's about the right distance. Okay, to help.
Sure, thing like that. That's the only way to do it. You're not touching it with your lips.
So Martin's demonstrating. Thank you.
The oxygen mask goes down. Welcome
to Renata from Healthwatch East Riding. We need a chair for you, Renata. Come over here. We need to make sure you've got a chair. Okay, so after those introductions, let's officially begin. So I'd like to begin this morning by welcoming our guest today, Councillor Dave Tucker, who has driven from near Spurn Point to be with us. That's nearly an hour and a half journey, so thank you very much, Dave, for coming. And Dave is the East Riding of Yorkshire Council Cabinet member with responsibility for adults, health and care. And he's fairly new to the job, but he's keen to hear our concerns, so we're very grateful for his presence with us today. So quickly, we want to consider our healthcare challenges in Bridlington, the demographics of our population. We want to hear your health concerns. We want to welcome Healthwatch East Riding. We want to report the results of our survey from the last public meeting in April, and we'd like to invite you to join the Health Forum if you're not already part of the Health Forum. So, we have considerable inequalities here in Bridlington compared to other parts of the East Riding. The age distribution, the socio-economic deprivation, the shorter life expectancy, and the disease prevalence. Now, half of the over 65s have 2 or more health conditions, and are responsible for 2/3 of all hospital admissions. And we know that both age and deprivation increase disease prevalence. I don't want to blind you with very detailed slides, but just a few facts about Bridlington. On the left-hand side, we have a list of the East Riding wards, and you can see the Bridlington wards in red. And this is a heat map looking at the age of the population, town residents over the age of 65. And you can see in Bridlington we have 12,495 residents over 65. Goole has 4,100, and Beverley has 8,217. So we have the most over 65s. We feel that our district hospital is underused, and we know that residents of Bridlington and Driftfield are travelling 1.5 million miles to outpatient appointments at distant hospitals. So we can see that areas like Beverley have the big hospitals in Castle Hill and Colroy Infirmary much closer to hand than we have Scarborough. That map is not to scale. Scarborough Hospital is off the map actually, and also Malton is not situated exactly where it's shown on the map. So that's to give an overview of the East Riding. So the next map is residents aged 65 to 84. Again, Bridlington is in the red. We have the most at 11,000 residents. And then Beverley comes second at 7,000. So once again, you can see that we stand out. In fact, the North Ward in Bridlington is about 44% over 65, which is a significant percentage. And then looking at the heat map for the over 85s, we also have the most residents with 1,475. Beverley has 1,145, and quite a lot of East Riding has under 500 in their wards. And this is a heat map showing areas of socio-economic deprivation, with the most deprived areas in the darker red colours, and the least deprived areas in the lighter green colours. And the darker green colours. So this is pointing out that 9 of East Riding's 13 most deprived areas are within Bridlington. There are also pockets in Withensea where Councillor Dave Tucker is familiar with Withensea and Goole, but that's where most of the areas of deprivation are. And if we look at male life expectancy, we know that in Harrogate, the average male will live to 87. Well, in the South Ward of Bridlington, and I live in the South Ward, the average age expectancy is 73.6 years. So again, we are below the average there. The average is Driftfield and Rural at 80, and the best life expectancy in East Riding is Willoughby and Kirkella at 83.5 years. Then if we look at the percentage of the population with any particular long-term condition, cancer, stroke, hypertension, COPD, severe mental health illness, diabetes and dementia, we actually have a larger percentage of the population with all those conditions in other areas in East Riding. And I'm sure people who work in our general practice are well aware of the numbers of patients with long-term conditions. So we have the highest prevalence. And then we look at emergency hospital admissions. Once again, we're topping the table in Bridlington. And these are standardised admission ratios compared to the average for England. Now, Bridlington Central and Bridlington South have significantly higher hospital admissions than the average. And as you can see, we are generating considerable amounts of secondary care work for particularly Scarborough Hospital. We know some of our admissions go south to Humber as well. I wanted to just cover the aims of the Humber and North Yorkshire Health and Care Partnership, this is the new organisation that's established to oversee our health services. They are aiming to meet health and care needs and coordinate services across this massive area, which is a combined area of 6 CCGs. They want to plan in a way that improves population health. They want to plan to reduce inequalities between different groups. They also, I have read on their website, we want to create more efficient hospital-based services for people who need them, making the best use of the resources and workforce across our system to plan and deliver hospital care. I mean, that might well be true, but that speaks to me of the fact that they may use this as an argument for further centralisation of services because it's more efficient. And there are, of course, significant financial constraints within the health service. But we in Bridlington, of course, have suffered so many historic losses that we know the population are not content with what's been happening. The Humber and North Yorkshire Joint Forward Plan has been published, and it's quite general. It talks about starting well, wanting every child to have the best start, living well, wanting to ensure that the next generation are healthier than the last, ageing well, ensuring people live as healthy and independent lives as possible, as long as possible, and then dying well, wanting to create an environment in which people can have positive conversations about death and dying. And of course, we've got the primary care hospital services and our social care services to help with this plan. Starting well, yes, we've got maternity in Scarborough, we've got paediatrics in Scarborough. We do have a local urgent treatment centre, but we know that can't cope with all our needs and that many people still have to go to the A&E department in Scarborough. We agree that the wider determinants of health and health promotion are important to consider for those who are not yet unwell, but what about those who are ill at the moment, and particularly our older population? So we need accessible local services and accessible local diagnostic services, so we don't have to be travelling vast distances. It seems as if those that we're being penalised in a way for being geographically isolated. And finally, concerning dying well, we need frail and elderly care locally. We need more local palliative care. We all know that we're greatly missing our Wolds Macmillan unit. We know that there are real challenges in that area. So we're looking for some of the services to come back to Bridlington and to allow people to die closer to their families. So this just summarises what I think I've just said. We in the forum, and we want to make sure that we are representing everybody's views today. We do believe that we deserve more local and more of these services: clinical diagnostics, enhanced urgent treatment services, outpatient appointments, surgical operations, those operations which are safe to perform in Bridlington Hospital and end-of-life care. So just before I introduce Councillor Dave Tucker to say a few words, just want to report the concerns from the last public meeting. We asked the people who attended to list what was most important and least important. So a score of 1 meant most important. And that was the questionnaire. People could put their scores 1, 2, 3, 4, 5 in whatever order they chose. And these were the results. So primary care was the area of most concern. Hospital services was the second. Dental services, of course, which are severely lacking in Bridlington, was on third on the list. Social care and mental health, in that order. I think we have to remember that our meetings, our public health care meetings, are not going to be representative of the whole of our Bridlington society, and that there'll be many people who are not represented here. So, in fact, we are representing the whole community, so we've got to remember the needs of the whole community and those who might not be so interested in coming to public meetings like this, but who have significant health needs. So, I'm just going to blank off the screen just at the moment before we come to listening to your concerns and ask Councillor Dave to introduce himself, say a little bit about his background, describe his current role and what he can and can't achieve for us. Thank you very much, Dave.
Okay. Well, can you all hear me? Yes. Well, that's a good start. I hope what you'll find is when I speak to you now, you'll see a lot of crossover with what Dr. Clark's just been speaking about. Because obviously, when I was invited today, I did some digging to see actually what the general perception of some of the problems are in Bridlington. So, firstly, I'd like to start by expressing my sincere thanks to Dr. Clark, Councillor Walker, who's there, and Councillor Richardson for inviting me today. And what I'm here for today, and what I'm really keen to find out is, because as Dr. Clark said, I'm new to role, I've been in role since May. I want to listen to what your concerns are. I want to find out what really is concerning you regarding your healthcare in Bridlington. As we know, inequality refers to disparities in health, and that's what Dr. Clark was talking about. And it exists in different proportions of different groups. What I'm going to start by saying is I'm very clear on my role. Yeah, my role is not to make decisions for the NHS. That is down to, as Dr. Clark said there, is down to the ICS, the ICB and the ICP. However, it is my role and my responsibility to work closely with your ward councillors, and not just Councillor Walker and Councillor Newton. I can see lots of other ward councillors in this room from all parties, to support them to make sure that your voices are heard at the right table. So as portfolio holder, what my job comes in is this. What I have, which ward councillors don't particularly have, is I have a very clear pathway into the ICS, the ICB and the ICP, the decision makers. And how I see my role is going into those meetings, making sure your voice is heard at that table. Because at the end of the day, you are the users. And people like myself, Councillor Walker, Councillor Richardson, and all the other councillors are elected by you, the electorate, to represent you. So that is how I see my role. Unfortunately, we don't make the decisions, but actually we can influence them, and we can make sure your voices are heard. Technology is great, it switches off. Okay, so a bit about me. I've recently retired from the NHS. I was a nurse in the NHS for 40 years, worked in intensive care through the pandemic, which wasn't fun, I can assure you. A lot of my career was in oncology and haematology, particularly around palliative care. Yeah. It was mentioned by Dr. Clark about the wards unit. I remember sending patients to the wards unit, and it was a flag carrier. It was the place to go. If you wanted quality end-of-life care, you went to the wards unit. And we need to look at issues like that. Why has it gone? Why have you got a hospital stood down there with a lot of capacity. What is going on? So, what we do know is that certain groups, including minority communities, people living in poverty, coastal communities, which are you guys, and particularly ageing populations such as Bridlington, which Dr. Clark referred to on the slide, actually have barriers, active barriers in accessing healthcare. And it's those barriers that it would be my role to explore with the NHS to see what we can do and what is possible. I'll make no false promises to you. I will work hard on your behalf, as the ward councils work very hard on your behalf, and this forum works very hard to make sure your voice is heard. So, it's my wish today to sit back, listen to what you have to say, because you need to tell me what really concerns you. Because unless you do that, you haven't got a voice. So I'm going to be writing like mad, so forgive me if you see me scribbling. It's because I'm writing down what you've got to say, so I can carry that forward. So I'm very grateful to have this opportunity to be here at this meeting. But it's critical, the critical issues around health inequalities need to be explored. It will not be a quick fix. I know this has gone on for a while, but I am very keen to engage. I'm new to the role, I've got an NHS background. By my very nature, I'm a caring person because I was a nurse for 40 years. I think that says quite a bit. But I'm hoping by working together with the Health Forum, with your ward councils, like Council Ward Council and the rest of the ward councils, we can actually work to make sure that your health qualities get addressed. And if nothing else, make sure your voice is heard loud and clear at that table. So basically that's me in a nutshell. So thank you for listening. Please forgive me if you see me scribbling, but I will be writing down what you say. And and I'm hoping that in the future we can have a close working relationship. I hope to get invited back and actually give you some updates on where we're going. So thank you for listening.
Thank you very much, Dave. So now we have an opportunity for you to raise your concerns. Andy, would you like to take the microphone around? And just a reminder for those who missed our mention earlier of how to use it. Oh, that's good. Yeah, you need to keep the microphone close to your mouth. Apologies if I haven't done that all the time as I've been speaking, but may we take some questions, please? Gentlemen? Okay, 1, 2.
Good morning. I'm just wanting to know what's happening about Bridlington Hospitals. We need services out of it. Every year, they're complaining at Scarborough and whatnot about bed blockers. People of my age now are on about who can't go home till they get all sorted out. Why can't they be looked after in Bridlington? And also, we haven't had a doctor's surgery in Flamborough where I live for about 2 years, 2 or 3 years. And it's still closed, and the village is getting bigger by the week.
Yeah, thank you. Yes, you're right. Our population is going to grow. We've got a planned additional 3,000 houses coming to Bridlington, which will increase our population. And I was just thinking the other day when I was listening to the news and about global warming and how temperatures are going to increase. There'll be more and more people wanting to come to Bridlington. It's such a nice place to live. On the coast, and we're going to need more services, and yet we're at the moment suffering inequalities. But we have many people coming across, and we thank you for that point. But yeah, Bridlington Hospital is being used. The Bridlington Care Unit is a unit for people who have no right to reside in hospital. Bridlington Hospital has a ward for these patients who can't be discharged home. And part of the problem is a lack of social care, which also comes under Councillor Dave Tucker's remit, but can't be solved overnight. So York Hospital has got a care unit like this, and so has Bridlington Hospital. So these are patients from all over the place, who have been discharged mainly from Scarborough Hospital, I think, to Bridlington, awaiting further placements. Have I answered your question?
Scarborough, they're sending patients out project and it ain't. Going to Malton, this is absolutely ridiculous.
Okay, in case you didn't hear the question, it was the gentleman feels it's ridiculous that urology appointments are being offered in Malton. And I have to say we totally agree. We've been in long-standing discussions with York Trust about that very subject. We are going to get some nurse-led appointments back in Bridlington, but we've been told categorically that it's not possible for consultants to come. Although we had a very good consultant service in the past from Scarborough, but because, you see, there was a Senate report some time ago for the York Trust that recommended a urology centre in York and one in Scarborough. But what they chose to do was to put it all into one place, into Malton, as a one-stop shop, because that's more efficient. And it does mean it's particularly difficult for us to travel from Bridlington to Malton. And we know that there's no easy public transport. We know that the taxi can be £100, return.
So therefore it's not more efficient, is it?
It's not more efficient from the patient's perspective. It's more efficient from the financial side of the trust. Absolutely, yeah. We totally agree. We're doing our best, but we need more help from the public to actually get York Trust to reconsider that issue. We'd like to see more radiology appointments locally, more ophthalmology appointments locally, and more dermatology appointments locally. There's no dermatology appointments at present in Bridlington, as far as I'm aware. So there are lots of specialities. This move of appointments away from Bridlington has been exacerbated during COVID, and this is what we're trying to reverse.
What's an excuse for that?
Andy, where are you?
Excuse me,
Yeah?
I am voicing an opinion, which is, why isn't the shuttle bus back?
That's a good question.
Because unfortunately, I could pick myself for marching to save Bridlington Hospital. There are loads of wards which are closed off. There is not even an emergency dentist in Bridlington Hospital.
That's correct, yeah.
So why are we not using Bridlington Hospital? Because at the moment it is a white elephant.
I think you're expressing the opinions of a lot of people, and certainly within the forum we share your opinions. I was having a discussion with our East Riding Place director, Simon Cox, who's part of the Integrated Care Board the other day, and he seemed amenable to looking at the question of the shuttle bus. But obviously that's second best. What we want is more appointments in Bridlington.
We want the hospital to be open to everything, not only for appointments, but also for main operations and everything else.
Yeah, we understand what you're
I
saying.
know that there are wards which are closed, which could be open. I also know for a fact that there are loads of people who wait when there is emergency services. They are full at Scarborough and other places, reducing the risk to other people when we could be opening Bridlington Hospital up to alleviate matters in Bridlington.
Yeah, I understand what you're saying. Back in 2008 there was a reorganisation of services, and we lost the coronary care unit here in Bridlington, and we lost the acute medical admissions, and so they were centralised to Scarborough, and we did say that this was going to put pressure on the ambulance service, which has happened. We were also promised additional investment in Bridlington Hospital, such as a CT scanner. None of the other recommendations of that report have come about, so it's all loss and no investment in Bridlington, which is what we want to reverse.
I'd just like to say, I'd just like to say that I worked as a nurse at Bridlington Hospital. I was a nurse for 37 years until I retired. I worked on the surgical ward, which was initially a very busy ward. It wasn't just day case. We did all sorts of operations, hysterectomies, the major things, mastectomies. And then in the latter end, it was turned to a day case surgery. In that day case surgery, we used to do vasectomies, we used to do hernia repairs, we used to do all sorts of things that could be done in Bridlington that didn't require a doctor or consultant to come and stay or whatever. It was running perfectly well, and then after the COVID hit, all these services, all of them, on the day case unit where I worked, was taken to Scarborough Hospital, including all the staff that had to travel on a daily basis to Scarborough.
Thank you for that. Yeah, we have heard about that, and it is a problem for providing like continuity of care in Bridlington if the staff are suddenly whisked off to Scarborough. Councillor Dave?
Thank you. Can I just clarify a point there? Because I said I'll be scribbling like that when people are talking. The lady said, sorry, the retired nurse. I am a retired nurse too. You said that you was doing day surgery up until COVID, when COVID broke, you lost it. So you lost, doing surgery up to 2021.
Before, well, I would say probably the year before COVID. I
So-
retired, I've been retired for a number of years now, but probably around about 2020. I know when I worked as a nurse, I was travelling up to Scarborough to work in departments that I'd never worked in because I was, as a surgical nurse, I would be taken and I had to go and do a shift on A&E or wherever, on a medical ward, depending where I was needed. So, you know, it's gone on for a number of years.
Yeah.
It hasn't just...
But the point I'm trying to get to is you was doing surgery in Bridlington Hospital up to 2020. Right, thank you. I just want to clarify that. Thank you. Sorry.
Yes, we have an orthopaedic unit in Bridlington Hospital, which has a good reputation, and so we know that some quite major operations can be done in Bridlington. We would like to see, the Lloyd ward used to its potential. We'd like to see restoration of some of the other operations that have occurred safely in Bridlington. We recognise that with specialist surgery for cancer surgery and things like that, patients will need to travel to Hull. You know, we're not denying that. For heart surgery, for example, we can't reasonably expect to have all those services in Bridlington Hospital. We can't expect to have maternity service back in Bridlington. But we're looking at what can be done. But we need a change of attitude, if you like, from the Trust towards looking at Bridlington and seeing what can be done for our population, which is a growing population. Okay.
I think the main concern in Bridlington is that you can't always get an appointment to see a doctor. And if it was more easily available to make appointments with doctors, a lot of the hospital admissions would be nipped in the bud earlier rather than later. And from what I see, since the amalgamation of all the surgeries, we have a two-tier system in Bridlington. If you're a patient at Manor House in Practice 2, you can more or less whistle in the wind to try and get an appointment with a GP or anybody else. But from what I've heard, Practice 3 is run by a different society, company, whatever it is, and patients can get a doctor's appointment the same day. That's what I've heard. It may not be correct for a lot of people. I've heard several occasions where people have said they've got an appointment immediately. And I can't understand why we've now got a two-tier system of appointments and GP practices in Britain.
You're correct that there are two practices now. Doctors Ready and Nunn has got 26,600 patients. They are a partnership, and they've now got a staff of 70 people. They're working in new ways. They're bringing in a lot of new healthcare professionals, and it is amazing that they cope with so many extra patients in such a short space of time. The other practice is run by Humber Teaching Foundation Trust. It's called Humber Primary Care, and they're much like bigger organisations, so it does take them longer to agree changes. We have been meeting with them regularly, they are about to produce an action plan. They are aware that they have access problems. They are waiting for a new telephone system. We're going to be meeting with them again this week. But I'd urge you also, we have Paul Gibson here, who is the Vice Chair of the Patient Participation Group at Humber Primary Care. I'd urge more patients of Humber Primary Care to get involved with the Patient Participation Group.
In view of what the retired nurse has just said about her work being taken across to Scarborough and travelling across to Scarborough to do duties, why on earth is it not being reversed? Because as a new person coming to live in this area, you just said about the shuttle bus not being available. Well, I come from Doncaster, which has a very successful shuttle bus. Why are the staff not being transferred back? Like the nurse said, she was transferred to Scarborough. Why not transfer staff back? Because it's obviously a lack of staff and lack of availability that is drying up the situation in Bridlington.
That's a good question, and we will put that question to the York Trust once again when we next have a meeting. We have regular meetings, good operational meetings with their partnerships and alliances. York Trust is funded by the Integrated Care System or Integrated Care Board.
Doncaster, it's a private charity that does it.
Well, you could argue that trusts have historically been allowed too much power themselves because they don't seem to be sufficiently accountable to the public, to populations. But we are making some strides. We've got some governors now on the York Trust governing body within the forum. We're presenting the public view. We were very pleased that the previous chair, Alan Downey, was actually responsive to listening to the concerns of coastal residents in Scarborough and Bridlington. We're very sad that suddenly he's departed. We don't understand why he's departed. We feel that it's in the public interest to know what happened, but we haven't been given any answers. The York Trust now have an interim chair who is a member of the Integrated Care Board. So yeah, we're asking some searching questions, particularly in the light of the CQC report concerning York Trust. I don't know whether you've seen that, but it does raise a lot of significant questions about the leadership of the Trust.
The gentleman behind us actually mentioned it was easier to get an appointment at Practice 3. It's a load of rubbish. You try and see a doctor at Practice 3, you have to go through about 3 or 4 people before you get to him. Not only that, if you've got an appointment, right, say a cataract, why don't you do that in the centre place? My wife went to Hull, my friend goes to Malta. What happens if you can't drive?
Absolutely, yeah.
Yeah.
We are wanting more.
Exactly.
We want more ophthalmology outpatient appointments locally. There's no question about that. The York Trust are planning to have a cataract assessment clinic once you've been put on an operation list for cataract surgery, because they've got some new equipment so they can assess the type of cataract you need, and they're going to have. They're planning to have that clinic up and running in Bridlington. But what we want is more of the initial outpatient appointments as well. Yeah, your question about not necessarily seeing a doctor within primary care. I'm afraid because of the shortage of GPs, this new ways of working has had to be introduced.
So it take you longer. You see 3 people before you get to the doctor. But you get to the doctor.
Yeah, well, if the person
So
you
you wait
feels
longer
that you
to
need to
see a doctor.
see the doctor, then the doctor can be called in. The doctor.
No, you have to make another appointment.
No, you don't.
Yeah, but you don't see a doctor straight away. You have to make another appointment.
There seems to be some different people. People have had different experiences over that. But Andy, the lady here.
Yeah. For Practice 3, I had an appointment with one of the nursing staff she examined me, realised that she needed a doctor to come in, and immediately a doctor was called in. It depends on exactly what's wrong with you at that moment in time.
I'm Dr. Reddy and Nunn's PPG chairperson, and they have got a new telephone system in place, which if you stay online, it is activated. If that line is busy, more staff come to man it. So you shouldn't be waiting on the telephone line very long.
It took me 45 minutes to get anywhere near the number.
Please come to me and give me your details, and we'll look at dates and times to see if there were anything specific going off that day.
That's not every time. It always takes more than half an hour to get to.
There are other professionals, as Dr. Clark's just said, associate physicians, people in training who are being mentored, so that we're growing our own professionals as well, and some more coming back. Like Dr. Clark said, we've now 70 practitioners in place. You are being, when you've been called, being given same-day appointments, access to same-day appointments, and for people with long-term conditions, what they're looking at is that your long-term condition appointment will include all the investigations that you need at that time, so that you won't be having to call back at different times for different appointments, and that way we'll be more efficient too.
Can I just say something? I do know how well they're doing, but equally... Right, okay.
Just hold it near your mouth, Dawn.
Right, thank you. Yes, I do know that they are doing very well, actually. But equally, they have gone from 10,000 patients up to 26,000 patients. And with the best will in the world, and as many staff as you can possibly have, that was never, ever going to be pain-free. And the other thing that sometimes happens, and this has happened through all my working career, 30-odd years, that sometimes things go wrong. And sometimes things happen to people that doesn't happen to the majority. I think that what we've got to do with that now, and I'm sad to hear your story, but what we've got to do with that is actually look at what has happened and put that right, so that can't happen again. If the aim is so that people get access on the day to some kind of healthcare or a doctor, whichever is necessary, then the times it fails has to be looked at and has to be put right. So, and I'm sure that will happen. That will happen in time. And I'm really sorry that you've had the experience that you've had.
When the surgery at Wolseley was up on operating,
yeah,
you could get an appointment straight away. You can't.
Well, this is
okay. We'll take that on board, and we'll try and find out from you afterwards, you know, a bit more about the occasions you've had difficulty. Let's hear from some more people now.
Can I just ask when patients are going to be able to migrate between the two practices in the town? Because at the moment you can't move from one to another.
We can't give you that information. I don't know whether it's available yet. I think it's important that Doctors Reddy and Nunn, we've been told by the ICB that Doctors Reddy and Nunn, you know, need to get settled with these extra 16,000 patients before the lists are kind of opened up for patients to transfer between practices.
Hi, thank you. Jane Phoenix, Councillor Bridlington North. I just wanted to point to the statement that Anthony just said, that York Trust don't seem to be accountable. And I'd like Councillor Tucker, when he does get in touch with the ICB and particularly Simon Fox, to be asking referring to a document that there is, and forgive me, I don't know the name or the number of the document, but we've highlighted this many times, that the public have a right to be consulted. Part of the new remit with the ICB and the ICP, which involves Caroline Lacey, who is the leader of East Riding, her remit is the place that we call Bridlington, is her remit.
That's actually, it's the neighbourhood, Bridlington. The place is East Riding.
Okay,
Yeah.
okay, but her part of her role is to look at Bridlington, isn't it?
Yeah, and there is a Bridlington work stream within the Health and Care Committee.
Yeah.
That doesn't have any public input from Bridlington itself, although Health Watch, I believe, is on that committee.
But I'm referring particularly to the document, which is an NHS document, that says the public, when it comes to health matters, should be consulted from start to finish. That's correct, isn't it? This is what should have happened. I've only been a councillor for just over a year, and you guys have been here all that time, and you've been sharing this information, you've been asking these questions. As a councillor, I've been asking these questions, and I haven't got any answers. And what I want to know is why, and this is Simon Cox particularly we need to ask this question, why have the public, the people of Bridlington, not been consulted? All these people are here, they've given up all their time, they want answers. Why have they not been consulted from start to finish about what's going on in Bridlington? That is the elephant in the room, because these guys have not been consulted. They've been given information, which we try our best to do, but that is a question that I would like Councillor Tucker to ask Simon Cox. I've asked him, I still haven't got an answer.
Yeah, thank you very much, Councillor Phoenix. The first thing I'm going to ask you to do is put that in writing for me. And the reason I'm doing that is, when I knew I was coming here today, the first thing I've done, on the 25th of this month, which is not next week, week after, isn't it? I'm meeting Simon Cox, Caroline Lacey, Chief Executive of East Riding, where we're meeting at Bridge Spa, because my intent is to take your concerns to that meeting. That's the start of my journey, if you like. So actually, what you need to do, Councillor Phoenix, is write to me, because you're also a resident of this area, as well as being a councillor, let me ask that question for you. What you're referring to, by the way, the thing comes out of the Health Act. And that's the one he's referring to. Thank you.
Thank you. I think we've had a situation historically where we've been told what's good for us, haven't we? NHS England, the CCGs, it's good for us that we need to lose our Walter Macmillan unit, for example, when the CCG made that decision. And that would be, and the care would be just as good, if not better, because of having extra Macmillan support. Well, that hasn't materialised, and for too long, communities have been told what's good for them. We're seeking better engagement, with the powers that be, and we are seeking for them to be more inclined towards Bridlington as a coastal community with particular challenges. Okay, any more questions?
Yeah. Thank you. Firstly, I'm just going to embarrass my former colleague over there slightly, because he's quite a modest man, and he actually said he retired after COVID. He didn't. He retired before COVID and went back. So the man is an hero. Actually, my question is, whenever these considerations are made by your trust, thank you, will give me words, what consideration is given to the fact that the population of Bridlington doubles in summer? As at the moment, we're gone from 35,000 to probably somewhere around 70,000. And this happens every year, obviously. We welcome the caravan community, etc. Our economy relies on it. But is this taken into consideration when they look at the services at Bridlington Hospital? Thank you.
Yeah, I think that's a good question, and I think GPs, I'm a retired GP, I think we really appreciated that extra pressure in years gone by. More recently, you know, the Wolds unit and the walk-in centre at the hospital have taken up some of that load with temporary residents. It's a problem for Scarborough as well. It's a coastal problem, and I don't think that the planners really do take that into consideration.
My question is, what's happening to the early diagnostic equipment that's been talked about? I understand that Bridlington isn't going to get one, or it's unlikely to get one, but the information that you gave us on the map, we ought to be the first one in the queue. Is there been a decision yet as to what happened to the siting? But as a member of Practice 3, could I just say that the improvements that are going on there are absolutely fantastic. If you ring up and you're 20th in the queue, they get through that 20 in about 20 minutes. That every time you go there, something has changed, an improvement to the system. They're obviously looking at what goes on and trying to put things right. So, well done. But the question is, what's happened to the early diagnostic equipment?
Okay, yeah, thank you for your question. Yes. Yes, the government have made various announcements about community diagnostic centres for our area, and the first announcements suggested that, quite rightly, I think, that Withensea was going to have some kind of increased diagnostics, it may have been Scunthorpe, or and anyway, it doesn't matter about the order of things. The latest announcement is that Scarborough is going to have a diagnostic hub. So, in addition to the £50 million investment for the new A&E, there's going to be extra cash to provide a new building near the railway station in Scarborough, and they estimate another 91,000 diagnostic investigations will happen there, including blood tests. And so I think there may have been consideration of Bridlington being a spoke, not a hub but a spoke, but it certainly has been dropped. And in fact, Beverley will be getting a spoke. And I think by the laughter in the room, the concern that I know the Bridlington population feel that historically we are always losing out to Beverley, although we have actually more health challenges and we have an older population. So we have been pressing very hard. We were very disappointed, as you'll know from the press release we put out, about this decision. We're told that some form of increased diagnostics might be coming along the way at Bridlington. I mean, we'll be getting mobile MRI scanners and mobile CT scanners, but we've still had no assurance of exactly what diagnostics is going to be put into Bridlington Hospital to improve access locally.
This is probably where you start doing me. Is it working? Yeah. Oh, right, okay. I think Councillor Phoenix raised it at full council recently about the CDCs that are coming in Beverley, Withensea, and not coming here. That obviously caused me some alarm bells, because actually I live 12 miles south of Withensea, and that's my patch. And I was thinking, well, I don't know about this. So I've had lots of conversations about exactly what is and what is not happening. So I've got this in writing, and this is last week. There is no CDC planned in Withensea. What they're going to put in Withensea is a pad, so they can put a CT scan, the mobile CT scanners you get in Bridlington. You're going to have one there, and also they will site portable MRI. There is no planned CDC centre going in Beverley. I asked about here, and they told me that you've already got a mobile MRI and mobile CT. But I just realised very quickly, a lot of you urologists or urologists are all missing from here, and that came from listening to conversation I've had today. If I had it my way, every community would have a CDC, because the earlier symptoms are diagnosed, the longer people live. but I can only tell you the information I have. So at the moment, there are no CDCs. The nearest one's going to be Hull, Scarborough, Scunthorpe and Selby. Whether that's right or wrong, I personally think is wrong, but this is the information I've got, and I will never do is I will never lie. So, you know, I would love to say there's one coming here, but at the moment there isn't. But as I said, I've got a meeting week after next, and that's the start of my journey with the RCS, the RCP and the RCB, and I will be taking all the information I've got from here. But I just need to clarify that. Okay, thank you.
Thank you.
Hello. I've lived in Bridlington for 47 years, and I've never ever seen what's happened to the doctor's surgeries as it is now, with this Humber primary care. It's a disgrace. I've tried to get onto practice 3 times. I've been told you can't. But my doctor, Dr. Pearson, and my husband's doctor, Dr. Reed, they've gone over to there, but I'm not allowed to go. I've had issues with the primary care from day one. I've been hospitalised, which I shouldn't have been if I'd have seen a doctor. I'm a full-time carer for my husband who has dementia and Alzheimer's. If I'm hospitalised, I've got to find somewhere and somebody to look after my husband. I'm in a mess at times. Even now, I've just had an operation. You're in one night, you're in for the operations in Bridlington Hospital. I've just gone through that. I had to find somewhere for my husband. That wasn't easy. We don't seem to be getting anywhere at all. Everybody says, oh, things are going to improve. But they're not improving. Not in Manor House surgery was a good surgery. I was on the PPG there, and it was a good surgery. Now it's rubbish. You get on the phone, you're number 18. You get to number 3, and you're cut off. I've got to get up in the morning, leave my husband, get down to the surgery for 8 o'clock, and queue to get an appointment. Now, do you think that's disgusting? Because I certainly do. What are we going to do about it?
Well, we will continue to put those concerns which we have heard before, you know, to HPC. We are meeting with them this week. You can also talk to Paul Gibson over here, who's on the PPG.
I'm trying to get on the PPG actually again.
Perhaps you would like to join the PPG.
Yes, I'm already with the PPG. I want to get on the committee. We need somebody to do something in Bridlington.
So is it the access that's the main problem, or do you have concerns about the care itself? Because it sounds as if it's mainly the access that you have problems with.
We're trouble with the access, and we're trouble with the care. I mean, when you get to Bridlington Hospital, that was a good hospital. We've lost nearly everything because there are awards there that could be used for people to come out of the hospital in Scarborough, and we could use it for the aftercare. Also, we could use one of those places for the mental care. We've got no mental facilities here in Bridlington, and I'm suffering through that because of my husband. We need somewhere where they can go if we need, say, a break. We can't even get a break from this because there's nowhere to put people. We've got nothing. Bridlington is suffering badly, and now that we've gone into this Humber primary care, it's rubbish. I can't get on practice 3. But my doctors have gone there. That's not fair.
So it's partly the lack of services at Bridlington Hospital which makes you feel that the service from Humber Primary Care is lacking. Is that right?
Humber Primary Care and the hospital. We need something doing.
We certainly do need something doing. Yeah, thank you.
I know we're trying, but nobody seems to be getting anywhere.
Yeah, we are certainly trying. Gentleman at the back.
Thank you. Good morning. Just on practice 3, the change from Walls to practice 3 for us personally has been fantastic. And, you know, 26,000 people that we're looking after has gone really, really well. For us, I can't comment that anybody else. But the things that I wanted to raise was both my wife and myself are going through hand surgery or have been through hand surgery. My wife had to go to York, I think 5 or 6 times now. The original was going to be done in Bridlington, and the surgeon left and he went to Malton. We followed him to Malton because we thought that was the easiest and quickest way we would be able to get through. And that was then done in York. I'm having to go to Castle Hill, and obviously the nurse that said earlier that small operations could be done in Brid, that would be ideal. Now, the government, the Conservative government, and I don't know if this is political or what, so please excuse me if I'm on a tangent here, but they're promising 40 new hospitals before 2030. Why can't Brid be improved?
Yeah, we agree that we've got facilities which are lying empty or not being used to their potential, and we are strongly making this case. But I think there has to be a change of ethos within the health service and within the management of the health service, so that the managers take more note of public opinion. And this is a big problem, because historically these managers have worked, some of them, a long time in the health service, and they are used to telling you what is best for you, and that includes GPs, like CCGs would decide what was best. Things did improve with them having more GP input onto CCGs, but what we need is now more patient involvement with decision makers. So thank you for making that point. Yeah, absolutely. Simple hand surgery could be done in Bridlington.
Hi, Dr. Clark. We have a question online from a local funeral director, and it is, please can somebody ask why it takes so long for doctors to do death certificates and cremation forms?
Okay, well, I'm not a practicing GP now, I'm retired. I imagine part of the problem is a shortage of GPs, and this is one area where it does impact families at a very sensitive time. And it must cause the funeral directors real headaches. And I think that's something that we take back to the practices, yeah. So that's very important, because it's very much a human part of our experience, isn't it? People, if they have a bad experience of the death of a relative, it tends to live with people for years and years and years, and it's so important that we take a fresh look at dying well, which is one of the ICB's objectives. So thank you for that comment.
I would just like to say, can I, or anybody else here, have any hope at all that things are going to get better in the future?
We've had a little bit of hope from the York Trust, with movement of some services back to Bridlington, and the fact that they're willing to engage on a regular basis. But it is very slow, and it almost seems as if we can't consider multiple things at the same time. We've got to do one thing at a time, and it's almost as if we are being pushed down the line, and we recognise that they've had enormous pressures, through COVID and through winter pressures and everything. But we do wonder with the CQC report, whether it's also partly to do with the competence of the management, because that has been severely criticised in the CQC report.
It seems to me that a lot of these problems come down to the fact that as patients we're not treated as consumers. We're consumers in virtually every other aspect of our lives, whether it's buying something, whether it's now students at university, and we need to bring pressure on government, local government, the health services to treat us as the consumer of the service. I sat as a councillor on Wolverhampton City Council on the scrutiny board on the health service. We pulled people in front of us from the Midlands Ambulance Trust, the local city hospitals, and we got answers. We got answers to what our electorate wanted. We need to be doing that. All our elected councillors here, our members of parliament, our people sitting on the boards, we need to be making sure that this happens. We've got a forum here that's doing this, but we need as individuals to be bringing pressure to bear.
Yeah.
It's only by pressure that we can change a 1948 health service into something that's suitable for the 2020s and beyond.
Thank you, Peter. We do need your individual support, yes. We have a lot of support now amongst the councillors. To York Trust's credit, they do have a patient experience initiative, lived experience. They are trying to engage with patients. The question is, how much will that engagement affect their policies, their strategies? You see, we don't really have a strategy for the East Coast. We don't have a strategy or plan for Bridlington Hospital because the Trust, I think, would rather not develop a specific plan according to our wishes because they're trying to balance their books. I noticed that in the CQC report that their books are balanced and the care that they give was counted as good. So we've got to give them credit for that. But over a lot of the other decisions, the management decisions and the ethos within the Trust, that obviously does need to be changed. And the staff's experience needs to improve within the Trust. So it's going to take time to change things, but yeah, we need your help.
First of all, I'm fortunate to be a part of Practice 3's cohort, and I've got nothing but praise for all that they've done for years, and especially recently. And thank you, Dr. Clark, also for your really clear presentation with all the data, and your maps and heat maps and everything like that. I can't believe that the ICB and so on haven't got access to that data already.
They do have access to it. They have it, and there's joint strategic needs assessments within the council. The East Riding Council have access to that data because most of it is from.
So what I'm saying is, thank you to the councillors and the people involved, and keep on plugging on. It must be very frustrating for you when they've got this data at their fingertips, and then particularly ignore the demographics and the, even just the geography and plonk things in Malton and Beverley.
Yeah, thank you. I mean, it might be a good point to introduce Healthwatch and Renata Curado, who's come from Healthwatch, to explain how Healthwatch can listen to your concerns as well. Would you think that's a good point now? Yeah. So, Renata, please come forward. Take the microphone. We've got the East Riding Healthwatch contact details here. Renata is also relatively new to her job, and her boss is Cheryl Howell, who has come regularly to Bridlington, and we appreciate her support as well.
Hello. So, I'm very new to the role. I've been coming to Bridlington in terms of practices as well. We had a survey to understand where we could help to improve services and to see what was going on. Healthwatch, we basically, like counsellors, like the health forum, we want to hear what you have to say about your health and social cares in the area. So we sit in some boards, we sit in some, we also have some voice in terms of helping to make decisions, so to help to make and shape what's going on in the East Riding. And that's basically what we do. We want to hear what you have to say, and we will take it to the trusts and to help and shape the health and social cares here in the East Riding, not just Bridlington, but also within the East Riding. These are our contacts, so if you have something, I have some leaflets that I can leave as well. If you have any concern, any feedback whatsoever, it's not that we just want to hear what's bad, but we also want to hear what's good, so we can share it. And I've heard a few of you talking about that things in practices are not as great as the other one. So if you tell us what is good, maybe we can then share across surgeries to improve. And if it's too bad, then we can see what's good on the other one, and so forth and so forward. So it's about by having your feedback that we can actually help as well. So that's what we want to do. We want to help you, and for that we need your voice as well. Okay, I'll have some leaflets there. We are also on your Facebook page, so if you need to contact us, you can do via email or by phone. We are here to listen to you.
Thank you, Renata. I don't know whether anyone has any specific questions, but Healthwatch have conducted this survey about GP access. It was just before Fieldhouse Surgery moved across to Practice 3, and I understand that they will be repeating a survey about GP access later in the year. Is that right, Renata? At some point. No. Yes, I know it's a lot of work for you, but I've encouraged people to respond to that survey when it is published. So, actually, talking of surveys, this was up earlier. On our Facebook page, we have got this opportunity to feedback to the Humber and North Yorkshire Integrated Care Board and System. And you can go onto our Facebook page to see the link, and that would be a great help to get more feedback about Bridlington. Question, Councillor Norman.
Thank you, Anthony. Yes, the gentleman at the front there just mentioned that obviously we want the MPs, etc., and the councillors to keep up the pressure on the government to ensure that the services do come back to Bridlington. And I noticed that just last week, Greg Knight actually asked the question of the Secretary of State for Health and Social Care with regards to Bridlington Hospital. The response he got was integrated care boards are responsible for healthcare services which meet reasonable needs of the people for whom they are responsible. ICBs are responsible for evaluating the changing needs of the populations for which they are responsible and planning new services provision as required. That's absolutely fantastic. If the ICB could control what York Trust did with its money at Bridlington Hospital, because of course at the moment Bridlington Hospital, a lot of the wards just cannot be used because of the poor ventilation systems at the hospital, which is down to the lack of investment. We've got investment there in green technology such as solar panels, etc., which are going to be in there very shortly, but of course we need ways to get the patients back in there and the services. So hopefully the two can talk together and we'll get some movement forward. Thank you.
Thank you. Yes, I mean that would be great if that actually came about. That's what we're wanting.
Good morning, afternoon, not sure what we're on yet. So I'm a newly elected councillor for Bridlington for Central and North Town. I'm also Governor for York Trust, and I want to almost come back to the lady's question about is there any hope? And I would like to say I feel there is. You've got all of your Bridlington councillors here today. So Liam's here, I'm here, you've got Jane, Tom, Mike, you've got, where are we? Andy, Tim and Rick are all here. So every ward councillor for this area is here today and in some way is involved with the Health Forum. In terms of York Trust, it is an uphill battle. as a new governor, but Anthony and other members from the Health Forum do come along and speak on your behalf and do bring your feedback. As councillors, it's lovely to have David Tucker, our councillor, who is now going to take this role on, who has been a nurse for 40 years. So I would like to say there is hope, but if you read the QCQ report for York Trust, we are very much at the bottom, in my opinion, and I hope it's just upwards from now on, and I wanted to share that. And thank all the councillors for being involved and being here, and everyone who's turned up today. It's amazing that you guys have taken your time from your Saturday when it's not raining to come here, so thank you.
A big thank you to all of you. Yes. Another question down here. Now it's 11:42. Oh, one at the back and then one here.
Third, fourth in the queue.
Okay.
I'm trying to be
Could I just bring a question about going back to GP, sadly? Whereas I'm sure that the services during the day are good and patients are getting appointments during the day, I find that the out of hours is a problem, having to go through 111 to get advice. You pass on to a GP, and GPs tend not to come out and will only give advice over the phone. I've had personal experience with my father, which he's had to be admitted to hospital because we've not been able to have that GP care. And I just feel that working with the GPs and A&E and hospital aren't quite gelled together, particularly, as I say, after hours. If we could get that sorted out, that might just reduce a bit on A&E. If GPs coming out on call, is it a problem? Is there not enough on call in the night time? My dad was admitted to hospital at the beginning of June because we spoke to a GP through 111 and GP didn't come out, and we gave it a few more hours and we ended up having them admitted. So there is a problem there, and it's the GPs, A&E and the hospital, Bridge Hospital, all working together, which obviously we've said before that it does have an impact on the ambulance service as well.
Thank you for raising that. Yes, it's something we haven't had the time to look at yet, but we would dearly like to coordinate, Scarborough Hospital, the Urgent Treatment Centre and GPs, Primary Care Network here. They may already be involved with discussions, I don't know, but it is an important area. I suspect that there aren't that many GPs involved with the out-of-hours care, and we know that nurse practitioners have been involved for some years now. I don't actually know the current state of affairs, but that's something we can look into.
Hi, I'm Kimberly Thomas, working in the community. I'm also secretary for the PPG for Practice 3. Dr. Luke Manford, who's the director of HEN, which is Inequalities in the North, stated that 90% of the journeys into ill health start where you live. Now, we live in an area of severe deprivation, of child poverty, of an ageing population. If you just look at Yorkshire in the North specifically, we actually get 33% less funding than our southern counterparts and our Manchester, Liverpool, all the larger cities. This obviously subsequently then adds to the inequalities in health and the deprivation further. Yorkshire and Humber has a 6.9% bad health line compared to 5.3% nationally. So the northern burden not only impacts everyone's well-being within our area, but also directly impacts on economic health and economically and socially with regards to funding for bringing more money into our area. Now, if you look at obviously Yorkshire and Humber, again, the higher rate of economic instability due to ill health or disabilities is 5.3% where we live. That is compared to 4.1% nationally, which means we're in the top 5 trusts of the whole of the UK of suffering this inequality. Now, the issue with that is because we have the inequalities of not having the health services that we need, that's becoming worse and worse with people becoming more of a health burden, where people are becoming more economically unviable to be able to work. They're having long-term sickness, which then brings less funding into the area, which brings more burden again onto our health service, which is just sort of going further and further away. In regards to what you said earlier about the care package issues, 11.3% of people need care packages within our area, compared to 8.9% nationally. Now, the huge issue with that is that people are not getting the social care assessments. When they are getting the assessments, which is really difficult to be done because we are understaffed in regards to social workers, there's only a very small percentage, 2.3%, that are actually being given the care packages and plans that they need, and then they've got to try and get a carer. So again, then people are then needing to stay in hospital longer, which then goes on our services longer, and it's just sort of a massive spiral that seems to happen that's only going to get worse. It's also making it even worse that we've had 2.3 million reduced on mental health funding for our area within the last 2 years. And this is severely impacting more and more people, with 1 in 4 people reporting high anxiety in the last year within our area, and 6.6% of people being dissatisfied with the mental health support that we have in our area. Now, this is the scary thing. We have 172.7 people per 100,000 in the East Rand and Humber that are committing suicide because of the lack of mental health support. And that's compared to the national amount of 8.7 in 100,000. So it's huge, it's 7.7 in national. So it's a huge amount of what we have of suicides in our area because there's a lack of mental health support, which is implemented from the lack of primary and secondary care. So because we've not got these services at high rate at the hospitals, we're not getting the people diagnosed quickly for sort of cancers and other issues. It's implementing mental health, which is then causing suicide rates, which then implements more social issues for families, which then they come out of work, which means less funding for the area. So as you can see, it's a huge spiral by not having these primary and secondary care and the A&E in place to be able to support the area, if that makes sense. Sorry, kind of went around.
Thank you, Kimberly. Well, there was so much in there, and I think people will wish to applaud you for bringing so many facts and figures to our attention that demonstrate the inequalities between north and south. And of course, we feel strongly on the coast that as well as a levelling up, there needs to be a levelling across towards the coastal areas. So anything that you can do on a more national scene to raise these issues would be much appreciated, and thank you for what you are doing.
Good morning. I've got 2 points I'd like to make. The first one is people have talked about calling 111. The only once I've tried to call 111, after about 10 minutes of answering questions, I got a message that said, "I'm afraid 111 is not available in your area at the moment." It wasn't actually terribly helpful.
I don't know what happened then, but the main complaints I have over NHS 111 I've heard was people ringing up over their dental problems, because we've got so many thousands without a dentist, and they're being directed to places like Settle in West Yorkshire and Middlesbrough or Hull or and so not surprisingly we're getting complications. Anyway, carry on.
My second question is, it's nice to hear that all the councillors are here today, thank you for that. Why isn't there anybody who's making decisions from York Trust? That seems like that somebody from York Trust who is responsible for making decisions should be at this meeting.
Right. Well, let's take that on board and ask for somebody. We can ask. We will ask.
We have asked the ICB, haven't we?
We have had ICB representatives here, but it's a good point. We take your point that you'd like to actually have someone from the trust for them to hear your views. Oh yes, we have a public meeting at the Spa, being hosted by the U3A, University of the Third Age, on Monday the 16th of October, at 10:30 in the morning. and they usually have a meeting at that time. This one they've agreed, because they've asked us back for a third time to give an update. They've agreed that it can be a public meeting, but you'd have to pay £1 to get in, because that's what UCA members have to contribute. So we are going to be advertising that. Simon Cox from News Riding Place, and we hope one of his team called Will Oglow, who's been involved with the GP reorganisation. And we hope these two people are going to be there on that occasion. We will certainly consider whether to invite a representative of the York Trust as well. But yeah, if you could put that in your diaries, that would be a worthwhile occasion, I think, because we should be able to get a lot of people into the spa. And although it's not, it's only going to be like probably an hour and a half, it is an opportunity to show our concerns to those who've got the power to allocate budgets here or there. You know.
Anthony, last two questions, one here and one from Councillor Walker.
We are altering political boundaries in this area. According to what I've read in the press. Do you think this will have a bearing on what the future is for here when the political boundaries are changed? And one other point I made, I've listened as a new transfer into the area. I've listened and I am very happy with Practice 3. And from friends that I have that aren't in Practice 3, that have a really terrible time. If they take the doctors across, why on earth are they not pulling the rest of that? Is it just a matter of time till they pull those doctors from the Humber until they pull their patients across to join Practice 3? Because if it can make a success, which it obviously is from everything we've heard from people here, why don't they pull the other people across? And let the people with the expertise deal with it.
No, I can't give you the answer to that, what will exactly happen in the future. I do know that there has been quite a lot of staff turnover at Humber Primary Care, and it is a real challenge for them when they have members of staff leaving, because they then have to recruit new staff, and so we are waiting for their action plan as to how they will tackle things. And all I can say is the Integrated Care Board are aware of and they have been involved and they have been supportive of the GP reorganisation. So we don't have any qualms with the ICB over their support for general practice reorganisation, but we do understand that there are people concerned about one of the practices, particularly access problems.
Yeah, Will, please. I'd like to come back to the real point that I'm here, and that is that I was born here, I grew up here, and I absolutely know that all the services have gone from here. And it's a process of centralisation for efficiency by the deliverers of that service. That's what's going on. It's been going on for years. And it's not about the hospital building itself, which is now covered in solar panels and very efficient. It's the people within it. We need services to be commissioned in Bridlington. Not just a service commissioned, but delivered in Malton. And the people that do that are the ICB. They need to be our target. What they have said very clearly is that every process must involve the public. And this is not if they feel like it or if there's time. They legally must do it. This is 2022 legislation. So my message to Councillor Tucker when you're meeting with these people, realise that there's a whole northern section to the East Riding. And we're moving at a different, slower speed than the rest of the ICB. The ICB covers a huge North Links as well, isn't it? North Links, Humber, us, North York, absolutely vast. But Humber have been engaging with their population, their patients, and they produce results. The one on the top here is a classic example. That's, please, will you talk to us? And by the way, the survey ends tomorrow. Am I right in saying the one you couldn't put up there was the survey we were told about the day after it closed? So what you're doing by turning up here on a Saturday morning is giving us voice. That's the most important thing to do. It's a terrific thank you to everybody that has turned up, because the message we need to send is that it isn't for troublemakers up in Bridlington. This is the Health Forum, which is backed by the residents. If you haven't joined, please join the Health Forum. Please contribute, because it's your voice that we need to escalate up through Councillor Tucker to the people that commission the services and get them commissioned here. That means staff here. That means clinics. It means bringing the consultants over to lead that clinic, and those whole services start to have a life of their own then. It has to start by them realising that this is where the need is. Anthony's graphics to begin this meeting were absolutely clear. Like nowhere else in the East Riding, the need is here. So let's commission the services here. Please can we send that message? Thank you very much.
Thank you, Andy. So we've got a couple of minutes for our Vice Chair, Andy Levitt, to just explain how you can get involved and help us in the forum if you're not already members.
Hi. I've been in Bridge 45 years plus, and I've seen the changes. Like many of you, I'm frustrated. That's the reason why I got involved with the PPG, with the Health Forum. And if you want to help make those changes, if you're not a member of the Health Forum, sign up. See Maria, right? I always land Maria in it. She'll have an iPad or something with her and she'll sign you up there and then, right? Join our Facebook site. Put positive comments, put your negative comments. We are your voice. We are volunteers. We are your messengers. And I'd say, please don't shoot the messengers, right? Because we are trying as hard as we can to do everything within our power to improve the situation here for each and every one of you. There's our Facebook site. I don't want to take up more of your time, so thank you, Anthony. Right? There's a website that you can go on, and also the website you can go on, and it says who we are, what we do. There's various bits of information on there. You can actually join the Health Forum there, and that's probably the easiest way if you do have access to the internet to actually join the Health Forum. If you want to be an active member, and I can see that there are some people who have the potential to help us, say that you want to be an active member, say that you would like to become part of a committee or organisation, and what you'd actually like to do. Because the more we have, the better it is. Obviously, there's a big group of us at the moment, but the bigger that group is, the stronger our voices. These people have to listen to us.
Yes.
They have to.
On that point, you now need to invest the whole of the town population and district population in this, don't you? You need to get it out there to everybody.
Yeah, well, we are trying, but you can help us with that as well. Tell your friends, tell your family. I've actually gone strong arm on some of my family to join up, and some of my friends. The more people we have, that we can say we are representing the loud, loud voices. Your councillors are here. Your complaints, pass direct to them, because they'll pass them on to poor old Dave here, right? But that gives him more and more ammunition, right? These people that we're dealing with think that they're bulletproof, but the more ammunition we can give to this guy, right, the better it is. So please, 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 what else can you do?
This is just a plea to say if your appointments are being offered at a distant hospital, ask, why can't I have this appointment in Bridlington? Can it be changed? The more people ask that, the better. Yeah, these are the details of Caroline Lacey's and Sir Greg Knight's contact. Thank you, Andy. I want to just allow Councillor Dave to have the opportunity to finish off before we close.
Thank you very much, Dr. Clark. When I drove across here today, I had some pretty preconceived ideas of what the issues were going to be in Bridlington. You've just blown them out the water. All right? I haven't stopped writing for an hour and a half. It's ream after ream. A lot of this I've got to follow up. Kimberly, you're going to have to email me, because I couldn't respond to all that. But I just want to say to Dr. Clark particularly, thank you very, very much for inviting me. My ask to Dr. Clark will be, what do you want from me next? Because I'm going to go away with the councillors, Councillor Phoenix, Councillor Walker, Councillor Epperson, and, you know, they're the people representing you, and we've got a lot of work to do in the background, because when I was driving across here, and I'm not going to labour the fact, but it's an hour and a half, and I was thinking, well, it's all about the hospital. No, it's not about the hospital. It's a lot bigger than that, or it seems to me it's a lot bigger. And it's interesting, isn't it? Because when I was a ward manager in oncology, I used to try and get patients into the Walls Centre here in the hospital, because it was leading in the region. It was providing excellence in care. But the question was always, can you get the patient here before 5 o'clock? Because then we'd have GP. Well, GPs keep coming up, and the conversation today is some people think it's good service, and others don't think it's good service. So I think in the melting pot, it's a hospital, it's the GPs. Strangely, hardly anybody mentioned dental care, which that's a good point. Yeah, look, he's still smiling at me, so I'm doing all right. But I've got a lot to follow up on here, an awful lot, you know. So I'm saying thank you to you guys, because actually you've given it credibility. Because I thought coming across here like 20 people if I'm lucky. I've counted. There's 130 people in the room. Oh, and apparently there's more people outside. So I've got a lot of work to do. The councillors have got a lot of work to do, because they're the people who hold my feet to the fire in full council and ask me the questions that you can see on YouTube. So I've got a lot of work to do in the background. So I will come back to Dr. Clark, and it will be Dr. Clark. If you want to invite me back in the future to update you, that will be down to Dr. Clark and his committee. But all I'm going to say is thank you for inviting me. It's been an absolute eye-opener to listen to what you had to say. So thank you very much.
Yes, on behalf of the forum, thank you very much, Dave, for coming and driving an hour and a half and then driving an hour and a half back. It's a beautiful sunny day. Take the time, go to the north side, go to the south side, enjoy the sunside environment, see why people are wanting to move to Bridlington. But we don't have any warnings as you drive in to say, we are deficient of well, we haven't got sufficient healthcare. But yeah, a lot of people are moving here, but unfortunately they become disillusioned about the local services when they move. But we do give credit where services are working well. I think the people with dental problems are probably in too much pain to come today, or they're off, in Middlesbrough, Settle, Hull, trying to get some treatment. But it's the hundreds of children who are not getting their preventive care, who we know are going to end up. Some of them are going to end up having to have operations to remove their teeth, which is a great expense to the health service. we're really failing on dentistry. But we haven't had that many comments because I think people are apathetic that anything will be done. I know it's been put onto the ICBs to make improvements, but have the ICBs been given extra funding? Have they been given the ability to change the dental contract to make sure dentists stay within the NHS? I don't know. It is critical. It's very serious, and I think a lot of people are worried that the other aspects of the health service are going the way of dentistry, and we must make sure that doesn't happen. So thank you very much, everybody, for coming. Remember, there's Renata from Health Watch. There's Maria who can sign you up. There are other people involved with the forum. There's Paul Gibson from the PPG at Humber Primary Care. We've got Jill here, who's the service manager from Practice 3 as well, if you want to talk about Practice 3 issues. So thank you very much for coming. We're hoping that our next meeting will be, I think it's Tuesday the 18th of September, but we don't have a venue yet. Thank you very much.